Health experts at hospitals around the country have been working day and night treating patients diagnosed with COVID-19. But how are clinics that aren't specializing in COVID-19 adjusting to this pandemic? Dr. Abhilash Balmari is a cardiologist with Heart South, and he joins us now by FaceTime. Good afternoon, Dr. AB. Thanks for taking the time to talk with us this afternoon.
Absolutely. Good afternoon, Morgan, and the viewers. Thanks for this opportunity, and I'd be happy to answer any questions you have.
Well, one of the top things we want to know is how are you delivering care, and how have things changed during this pandemic?
Right, Morgan, just like the rest of the country, we are all in unprecedented times. This is a new disease. So earlier in March, when we weren't sure about what exactly was required to keep everybody safe, we pretty much limited ourselves to mostly telemedicine visits and only did emergent and urgent procedures. Over time, we realized that heart disease remains the #1 killer in America. A lot of people are still sick from heart disease. So we have reorganized our practice by screening out patients who may have suspected symptoms, by spacing out our waiting area, by offering telemedicine to anybody who's not comfortable coming in, and continuing to care for our patients. And I should say our staff and physicians in general have done an excellent job modifying our operations to suit the current pandemic.
Well, and obviously with heart issues, there's a lot of things that you have to do person to person. Like you have to be able to physically see your patient and check them out. But you were mentioning telemedicine. There are some things that you're able to do virtually like we're doing now. Can you tell me about that adjustment period for you specifically as a doctor trying to connect with your patients via FaceTime?
Absolutely, and again, this has been a learning experience for all of us, just like we are on FaceTime, as a mark of the times. But basically, a lot of patients I see may have simple routine maintenance care, like continuing their heart medicines or blood pressure issues, or they may have new concerning symptoms like chest pain, shortness of breath that requires a more personal attention and to be able to do certain testing in our office. So again, we've been trying to tailor the way we practice to the need of the patient at that time. And obviously, there are patients who are sick enough or in the hospital and getting cardiac procedures with adequate precautions. So the spectrum of disease and where they are kind of, dictates what needs to be done in person and what needs to be done over FaceTime. And thankfully, our patients are very understanding, and a lot of patients are not still comfortable coming in, and we totally understand that.
One of the things that's new that y'all have done is the Heart South Vascular Institute, and you were a part of initiating this. Can you tell us about the services provided through this facility now?
Absolutely. And peripheral arterial disease and venous disease are very common in this country. The symptoms may be very mild, from just leg aches, cramps, swelling, to ulcers, and sometimes result in amputation. Unfortunately, Alabama has one of the highest rates of amputation in the country due to undiagnosed disease. So we brought together a lot of the features we were offering for these diseases under the Heart South Vascular Institute umbrella. And we offer comprehensive testing for veins and arteries, usually as patients are referred from their primary care physicians, or they come in as part of their free vein and artery screening programs. So I think we are trying to raise awareness about this issue, and there is a lot of data that people who end up having an amputation have a poor quality of life. Their prognosis over the first 2 years after is very poor. So we have to do everything in our power to detect this up front and take care of this before it gets too far.
Absolutely, preventive medicine. Well, we really appreciate you taking the time to talk with us, Dr. AB, about how your life has changed during this crisis. I know everyone is experiencing something different because of this, and we appreciate you taking the time out to tell us how you're managing.
Oh, my pleasure, Morgan. Take care. Bye-bye.
All right.